X or the YouTube platform to let us know how the audio is. That would be great before we get started. Any feedback?
Not so far.
Not so far. Okay. We hope that you also are telling us if you can't hear, if you can read my lips. Anyhow.
Getting 30, sound is good.
Okay, sound is good. Excellent. Our solution is working. All right, so for your March 25th update, we're going to go ahead and get started. Before I start, I'm going to repeat something I said to the supervisors earlier, and I know some of them had difficulty hearing, so I'm just going to reiterate how incredibly impressed I have been with our leadership team, our supervisors, and our staff in their willingness to do whatever it takes to be able to continue to deliver the vital services that we provide to the people we serve, to support our staff, and to support our community during this unprecedented time. We have a tremendous team, and I am truly brought to my knees with how incredible people have been. So with that, I'll get started. All right, so on, I think it was Friday, I've lost track of the days a little bit, we had about 265,000 known COVID cases across the world and a little over 11,000 deaths. That has essentially doubled almost for both of those measures, close to it. As of about 11 o'clock today, we have 455,000, close to 455,000 cases and over 20,000 deaths in the world. And then in the US, over 61,000 cases and 849 deaths. In California, and the numbers on the California Department of Public Health website were last updated on March 23rd. I think they're pretty busy right now. We had 2,100 known positive cases as of a couple of days ago and 40 deaths. Both of those numbers have doubled since Friday as well. And then I just simply put the map of California with the known counties with community spread. And remember, community spread is when a county has individuals who have a positive COVID test and they are not known to have traveled to an area where COVID is present, nor have they had known contact with someone with COVID. So in those situations, we believe that they are acquiring COVID through normal community activities where the virus is prevalent. So I anticipate over the next few days that this map will all be red. Of the confirmed cases, those 2,100 cases, we still are seeing very few cases under the age of 18. You may have heard on the news yesterday that there was a death reported, I believe in San Bernardino County or Los Angeles County, I can't remember which one, where there was an individual who was under 18 who died. Subsequently, we've heard that there may be some other situations that were going on with that individual, so that has not been entirely confirmed. Lots of cases between the ages of 18 and 49, almost half of the cases. So that myth that this is an old person's disease and only people over 60 will get it is not true. Other people will get it. You just have a higher fatality rate for that older population. 50 to 64, 493 cases, and over 65, about the same, 450 cases. Some of the cases, they don't have all the demographic data, and I imagine those will get resolved in the next few days. In Fresno County, when we met on Friday, I think we were at 6 cases, and now we are at 18. And there are 10 cases where we are investigating how they acquired it. So it's quite likely that with those 10 cases, and I'm going to go back to the prior slide that showed, oh, look, it shows Fresno County with community spread. So I think once you pass 10 cases, that's when the Department of Public Health begins to think you have community spread, and it's quite likely when those 10 cases are investigated that at least one of them will have an unknown source. So I want you all to prepare yourself. There will be more cases in Fresno County, and likely, as in other communities, that it will increase, at least for a period of time, exponentially. We hope that increase flattens out. Remember the flatten the curve that we're looking for. But you should expect it. Don't be alarmed by an increase in cases. We have not had any deaths locally, and it's my understanding that none of the people that fit this positive, the 18, none of them are currently hospitalized. And so we'll continue to follow that closely. Just keeping this slide on here, letting you know one thing I've added to this slide, which is what the Fresno County wide response is they are looking at creating a possible hospital at the fairgrounds. That would be using federal and National Guard resources, both in terms of the equipment and furnishings for having a quote-unquote hospital at the fairgrounds, as well as the medical staff. One of the things that every community is struggling with is this surge in need that we anticipate in hospitals. You might be able to create beds, but where will you get the staff to staff those beds? For most of the hospital systems, what I'm understanding is they are having some staff who have been retired offer to come back. I understand that, for instance, physicians who are graduating medical school, which was supposed to occur in May, they're letting them graduate early so they can be added to support. And that's the kind of thing we're looking at. And then the military being brought in. There's a lot of medics and other medical staff in the military, and so that could be another source of staff for these hospitals. I think there's also a ship coming to the West Coast that serves as a hospital. I will say, if any of you watched the governor's address yesterday on Facebook, one of the things that heartened me was that he talked about some collaboration amongst the states to acquire some of the scarce supplies. Most of those relate to protective equipment for hospital staff, as well as ventilators and that type of thing. And so it's really encouraging that we're seeing some collaboration and cooperation and not competition for those. So what are we doing? Hopefully most of you have experienced that we're working very, very hard to ensure that those of you who are working from home have all of the equipment you need, either your personal equipment or county-owned equipment, that you understand how to connect remotely. We continue to screen all staff and visitors or clients coming to the facility. We're trying to ensure that both for our staff as well as our visitors and clients, that no one is coming into the facility with known sickness. I will say, and there's a couple of places in this presentation where I will talk about it, we appear to still have staff coming in when they're ill. I cannot emphasize enough how disappointing this is that staff are ignoring what we are telling them is for their safety, their loved ones' safety, your fellow co-workers' safety, the people we serve in your community. Stay home if you are sick. There is no benefit to anyone for you to come to work sick. So please follow the guidelines and do not come to work when you are sick. And if you sense a little frustration, I'm frustrated. It is a lot of resource for us to screen people, and when we can't trust our own employees, we're in a hard situation. So please, obviously some of you may come to work and develop sickness, alert your supervisor immediately and go home. And do not come to work if you are feeling under the weather. We continue with only essential personnel coming to work. Again, a reminder, essential personnel doesn't mean you're important or we don't need you, just that you can't do your job from home. And so I do need your flexibility as needs change. We may ask you, if you're not in one of those high-risk criteria or currently experiencing any symptoms, to come back to work from work. I can commit to you that if and when we get to that point, we will ensure that we've done everything within our power to create a safe work environment for you, and we'll have some detailed protocols for that when we get there. A reminder again that all at-home employees need to stay in close contact with your supervisor and remain available at all work hours as assignments are given. We will send an email out today subsequent to this meeting. Our HR department is having a meeting with main HR to get a few other questions answered that some staff or supervisors have raised. And then after that, we'll send out an email to all staff, really, again, clarifying and detailing some of the questions that have been raised so that you can have your questions answered. We do now have a warm line operational, and so I'm going to step aside and let Susan come in and talk a little bit about that warm line.
Okay. Thank you. Good afternoon. So you've heard previously that we were developing a warm line, and I'm happy to say that the warm line is operational. We have 13 DBH staff who've agreed to be operators for the warm line, and they are working collaboratively together through Microsoft Teams and email to create an ever-expanding list of resources and scripts to support callers from the community who need emotional support during the COVID-19 pandemic. So we are currently only able to offer that work of being a warm line operator to county staff who are working in our county buildings. Right now, the technology that we're using does require those calls to be picked up on our 600 phone lines. We are working on backup plans for that for those who are working at home and can't come to the buildings because of being in a high-risk group, for example, but we're not quite there yet. We will be publishing the number hopefully this evening. The Public Behavioral Health Division has done a great job putting together a flyer to advertise the warm line. That flyer indicates very clearly that it's not a crisis line, but on that flyer we do have other crisis resources available for the public to understand. So our call takers, the warm line operators, are providing supportive listening, ideas and supports around managing the various emotions associated with the pandemic, like anxiety, isolation, what do I do to talk to my kids, all sorts of other practical questions as well. So I want to give you all that number. The number is 600-WARM 600-9276. So we will be hopefully recruiting additional operators for the warm line. If that's work that you are interested in doing, please do work through your supervisor to make sure that's a good fit with your other assignments. And I look forward to seeing the call volume increase once we start publishing that to the community. I anticipate that the Public Behavioral Health Division will be putting that flyer on our Facebook page as well. So if you're not already following us on Facebook, please do follow the DBH page and then share that resource with your network as well. Thank you.
Okay. As you may have gathered from some of the information that we've shared with you, a question was raised earlier about how long is this going to last and when should we expect to be able to come back to work? And the answer is simply we don't have an answer to that. So all of these actions that we're taking and trying to anticipate is if this becomes our new normal for a while, how do we have the flexibility to make some of these strategies work? And so you may see over time, as noted in the PowerPoint, that we need you to be flexible too. And you may be asked to return to your workstation and do some work. You may be asked to do a job that is not in your normal work duties. And so we need you to work with us because we want to keep everyone employed and we want to keep everyone helping to contribute. We are first responders as county employees, and it is the expectation that we will do whatever it takes to support the essential functions of the overall county. So here's the slide that says, stay home if you are sick. And that if you become ill or develop symptoms, notify your supervisor, leave immediately. We will continue to communicate with you. You should expect to have additional invitations to calls like this, as well as emails. As I mentioned earlier, we'll be sending out some guidance this afternoon. Did want to go over our homeless outreach efforts. I've been focusing on that in each of these calls. We do have a shared leadership role with the County Administrative Office. We've been given this assignment to help solve for homelessness individuals who are homeless, who are on the street, and we want to prevent and limit spread of COVID amongst that population. In the 3 new shelters that were created, and just a reminder, one of them is the old Comprehensive Addiction Program on Whitesbridge, one is at 1040 North Pleasant, and the other is some units at the old Hacienda Hotel We've now housed about 200 individuals in those shelters. Included in that number are some individuals who we are working very closely with hospitals and emergency departments. These might be people who presented with symptoms consistent with COVID and have been tested but do not need to be hospitalized. So we've offered them an isolation location within the resources that we have. We also have some funding being made available through the state for hotel motels. We have some challenges that we're working through with that in terms of which hotel motels might be utilized. Some of the initial funding indicated that we would quote unquote take over entire hotels or motel properties, and right now that doesn't fit in very well with the need, so we'll be working through those details. There are also 28 travel trailers being made available through the city, and those are being options for where those might be housed are being explored. And then we're also continuing with strategies for individuals who do not accept shelter and remain on the street homeless, and how we can best support them. And then we're continuing to support existing shelters, including the Marjorie Mason Center. And so that work is ongoing. So at this point, whether you're viewing this through WebEx or YouTube, I would ask you to use the platform as we've done in previous presentations to ask questions. And I'll also remind you that this is being videotaped and recorded, and that will be made available after the meeting for anyone who wasn't able to participate. So if any of you get a question about how they could access that, we'll be sending it out as per usual.
Some Fresno County contract providers are using video sessions. They were giving training. Is the county going to provide training?
Okay, so this question was, some Fresno County contracted providers are doing video sessions and they were given training. That is something that we are working on. Some of our laptops didn't have the capability to have cameras and speakers and that type of thing. So that's one of the things that we're sorting through in terms of properly equipping staff to offer video sessions where appropriate. Once we have that equipment available, we would, of course, provide training. We're getting support collectively working on things like how-to guides and video tutorials, if you will, on how to set up your home for providing services and how you would utilize equipment such as video equipment.
Is the department susceptible to layoffs once normal life resumes?
The question is the department susceptible to layoffs once normal life resumes? What I would tell you is we're doing everything within our power to avoid that type of situation. But as you all know, there are many unknowns in terms of what the impact will be to our economy and to the revenue streams that we utilize to support our services. And so I am very committed to ensuring that we have the best utilization of the revenue we do receive. Unlike some counties, we do have a fair amount of funds in reserve, and we would have access to those funds. Those are dedicated funds. They can't be used for other county expenditures. I'm also reassured that both the state and the federal government is making quite a bit of funds available both to individuals such as you in terms of checks of support that will go out in the coming weeks, as well as funds to us to sustain our operations. So there's many, many unknowns. And I would tell you that we won't know for a long time what the long-term impacts will be, but we are doing everything we can to ensure that we mitigate those as much as possible.
Where do we direct clients that are seeking shelter, or is there a contact person for that process?
Okay. The question was, where do we direct clients who are seeking shelter? And I presume you're talking about individuals who are homeless. And we have shared with the leadership team, and we can share with the supervisors the resources and how to access those resources. But you can always direct your clients to the MAP points. So the Multi-Agency Access Program, and the one at the POB would be the one I would recommend the highest. And if individuals go there and go through the MAP point and they're seeking shelter, the POB can assist them in navigating through that process to get to the right shelter.
Okay, if we are working from home, are we expected to keep answering emails and keep in contact during breaks and lunch times?
This question is, if we're working from home, are we expected to keep answering emails and answering phones during break times? No, you are not. However, it would be expected that you would clearly communicate with your supervisor precisely when you are taking your breaks and precisely when you are taking your lunch. So what I mean by this is an email to your supervisor at 9:47, I'm taking my 15-minute break, I will return at 10:02. And that type of, that I do expect that you would have that level of communication so as to not have any confusion between you and your supervisor about when you're available for work and when you are not.
Can we bring our laptops into IT to get everything set up so that we can get access to the county drive?
Okay. This question was, can we bring our laptops into IT to get set up? What I would tell you is if you have a personal laptop at home and you're willing to use that for work, you should work with your supervisor and they will assist you with the process of how you would get set up. I would not want you just showing up to IT. They might not be prepared for you. They might not have the capacity to work with you. If you'll work with your supervisors, they're developing detailed plans to support you for working from home.
Okay. This person says, can you give any information about unlicensed clinicians who are in the testing process that may have been delayed, and how does that affect our 6-year requirement?
Okay. This question was about unlicensed clinicians who might be in the midst of testing, and that testing is delayed, and how this would affect the 6-year requirement. For anyone for whom their window of 6 years expires during this COVID crisis, and it is outside of their control, that testing period, we would certainly look at that on a case-by-case basis and offer relief from that requirement.
If we are needed for a position we are not familiar with, would it possibly be with a different department?
This question was, if we are needed for a position we are not familiar with, is it possible that it would be with a different department? Yes, it is possible it would be with a different department. We will, of course, ensure that our critical services have adequate staffing. But if, for instance, the job that you currently do, it's simply not possible to do during this time from home, or we're not able to support you being at work doing that job, then you might be asked to support another department. I'll give you a couple of examples. The Public Health Department has a hotline that we have staffs helping to support. Public Health does not have adequate staff to man that hotline. So we might direct you to assist in manning that hotline. Another example is that Social Services is anticipating that there will be a significant increase in the number of individuals applying for Medi-Cal, and they don't think they have enough staff to manage that, so we might ask you to assist with that. And so it's really, we will have to take each of these requests from other departments on a case-by-case basis, weigh those requests with the needs that we have, and we could ultimately ask you to do a job in another department.
Is the department relaxing credentialing expectations to maintain network adequacy?
This was a question about, is the department relaxing credentialing to maintain network adequacy? The state is helping to guide us in this regard, and so they are trying through the Provider Enrollment Division to create fewer barriers and expedited processes. And so there is statewide support for us to ensure that those entities that were in the queue, if you will, to get certified will be expedited. And so we're working closely with the state in order to maintain network adequacy.
Is there an estimated time when those with underlying conditions like asthma can return to work in the office if we are healthy?
Okay. There was a question about, is there an estimated period of time for individuals with underlying conditions such as asthma who might be able to return to work? As we contemplate that this could go on for a period of time that's unknown, we will look on a case-by-case basis of an individual's underlying condition and willingness to work. We're exploring right now what that process will look like, whether it will be something like you would have to have support from your physician that it's safe for you to come to work, or something like that. So we would look at that on a case-by-case basis. If there's people working from home where it's difficult to do your work from home, I would ask you to work with your supervisor as we work through that process.
If someone working from home has connectivity issues while working and can't get connected, do they code O1 or AN11 or personal time off? Or?
Okay, so if someone is working from home and they're having connectivity issues, how is their time coded? What I would say is you need to be in close communication with your supervisor, either by phone or email. Obviously, if you have connectivity issues, that might be more likely to happen by phone. You need to describe exactly what issues you're having and trust that your supervisor will work with you to code your time accordingly.
Working from home, are we expected to work overtime to attend these all-staff meetings with the director?
The question was raised that if you're working from home, are you expected to work overtime in order to attend these all-staff meetings with the director? I'm not aware of anybody in our department for whom the timing of these all-staff meetings would result in overtime. However, if you feel that they do, you should work closely with your supervisor to arrange to view the recording during your regular working hours.
I'm just laughing. I know someone who is a new hire expected first day April 6th. What can they expect to be doing?
Okay. This is about new hires that have scheduled start dates. Again, we're taking it on a case-by-case basis, and you should trust, if you are the supervisor of the person who's been hired and you're not sure what to do, please work with your supervisor who can assist you in creating a strategy for that.
How is county leadership working to curb stigma against Asian members of our community due to the messaging of COVID-19?
This was a question about how are county leaders working to reduce stigma and discrimination about the source of the COVID-19. Specifically, I presume this is referring to how some of our local elected and national officials have referred to the virus. We have produced a number of documents, and we are also adopting some documents that others have produced that we've pushed out via social media addressing this very issue. I would encourage you, as Susan said, please go on our Facebook page and you can find those documents. If you're unable or you're not on Facebook, please contact us directly and we'll make those available to you. We're also talking about that in media and such. And I would highly encourage, it's going to take all of us working together to reduce stigma and discrimination in general. So feel free to use those documents when you're talking in the community to help reduce the stigma and discrimination about this.
The president stated he wants to open up the country by Easter. Is this date also the goal of the county? Can we assume that we'd be back in the office the following Monday?
So this question is about the president's stated goal that everyone will return to work by Easter, and should we expect the same? No, you should not expect the same, because I don't think any of us can predict when this will end. And I think that each day, as we find greater and greater impact of the virus, our elected officials will have a new perspective. And so this is a day-by-day, hour-by-hour, minute-by-minute changing situation. And I've learned through this that what I think today could change tomorrow. And my assumptions of today are not my assumptions tomorrow. And that's been borne out throughout this process. I think some of you are aware, and I'll tell you, the beginning of the week where it became clear this was an issue, I was supposed to leave for Hawaii at the end of that week. And I thought I was going to go. And within a few days, it became rapidly, progressively clear to me that that was not going to happen. And that's how this entire process has worked. We make assumptions on Monday, and by Wednesday, they've changed. We make assumptions on Wednesday, and by Thursday, they've changed. And so I appreciate that we have elected officials across both the political spectrum as well as the national, state, and local perspective. Lots of opinions out there, lots of goals, but this is going to be a day-by-day decision-making situation.
Some employers are providing letters to their employees in case they get pulled over to show you are an essential worker. Is this something the county will be doing, or is it not necessary?
This was a question about some employers are providing employees with letters. Your letter is your badge, and you're supposed to wear your badge every day. So if I don't know that anyone's getting pulled over. I don't know that there's plans to pull people over to test whether or not or assess whether or not they're an essential service. But the county is government, and government of all type is considered essential. And so if you have your badge with you, that should suffice.
For those working from home, how will they get updates on their laptops? I remember having to dock it at least once a week to receive updates. The
Okay.
answer to that is just stay on the internet and they'll get them on the web.
Okay. There was a question about updates on laptops because the person asking the question said they remember having to weekly update their laptop. And the answer to the question is that if you're connected to the internet, those updates can happen automatically. So that would be how you would get the update, is connect to the internet. You don't have to bring your laptop into the office in order to get that update.
Is there outreach for the very seriously mentally ill homeless?
This question is there outreach for the very seriously mentally ill homeless? With our homeless efforts, we have prioritized those individuals who are over 60 or have an underlying medical condition, including psychiatric conditions. And so we have prioritized them to be sheltered. If they are already engaged in our services, then our staff is working on those strategies as well. And so yes, they are being prioritized.
How much notice will we be given to return to work?
This is a question about how much notice will we be given to return to work. That, again, is a case by case. Because we are considered first responders in an emergency declaration, you should work closely with your supervisor. If there's a reasonable explanation as to why you need more time to return to work, then we'll address that on a case by case basis. Okay. That is the end of the questions we have thus far. If you have any questions that we were not able to get to during this, or that you think of after this presentation, again, I would strongly encourage you to send those questions to your supervisor or directly to me, and we will do our very best either at our next session or in the interim to provide you with guidance on that question. Again, I want to convey to all of you how proud I am to work with each and every one of you. And please know that we continue to work very, very hard to ensure that our employees are able to continue working and continue serving the needs of our community as well as the needs of our staff and clients. Thank you.